Everyone, myself Archana. Today's topic is laryngitis. Laryngitis. Larynx is larynx, itis is inflammation. Larynx is a part of respiratory system. It's a hollow tube that lets air passes from pharynx to trachea on the way to the lungs. It also contains vocal cords and is essential to human speech, often called voice box. The three main functions of the larynx is breathing, creating vocal sounds, preventing food and other particles from getting into your trachea, lungs, and rest of the respiratory system. So, in most cases, it gets better without treatment in about a week. What is laryngitis? Laryngitis it is an inflammation of voice box from overuse, irritation, or infection. It can be acute, lasting less than 3 weeks, or it can be chronic, which can last for more than 3 weeks. Inside the larynx or the vocal cords, two folds of mucous membrane which cover the muscle and cartilage. Normally, the vocal cords open and close smoothly, forming sounds through their movement and vibration. But with laryngitis, the vocal sounds become inflamed or irritated. This makes the vocal cords swell, which distorts the sounds produced by air passing them. So, as a result, our voice sounds hoarse. Causes of laryngitis it can be acute or chronic. Acute laryngitis include viral infections caused by parainfluenza type 1 virus, influenza virus, adenovirus, rhinovirus, and vocal strain, which is caused by overusing your voice. Bacterial infections, these are less common, such as diphtheria. Chronic laryngitis, it is caused by inhaled irritants such as chemical fumes, allergens, or smoke. Acid reflux, also called gastroesophageal reflux disease, and chronic sinusitis, excessive alcohol use, habitual overuse of voice, such as singers. Coming to pathophysiology, invasion of causative organism into laryngeal mucosa and non-infectious disease. The causative organism it can be bacteria or virus, and this can lead to antigen antibody reaction. We have our antibodies; they are attack the foreign of the bacteria or virus. So this can lead to histamine and prostaglandin releases. These are the chemical mediators of inflammation. So these start to release in the body. Inflammation of the laryngeal mucosa, which can lead to endematous of vocal cords. So they will not able to vibrate properly. Voice will not able to come out. Persistent voice disability will occur. Coming to symptoms of laryngitis can become suddenly and usually get worse over a period of 2 to 3 days. Common symptoms of laryngitis include harshness, difficulty speaking, sore throat, mild fever, irritating cough, a constant need to clear your throat. If laryngitis is associated with another illness such as cold, flu, throat infection, or tonsillitis, the following symptoms may also be persist: headache, fever, swollen glands, running nose, pain when swallowing, tiredness, aches and pains. So diagnosis it can be done by physical examination, laryngoscopy. So this is the procedure which involves inserting a thin flexible tube with a tiny camera and light through the nose or mouth and into the back of throat. So then the doctor can watch the motion of the vocal cords when they speak. Biopsy can be done if a doctor sees a suspicious area. Biopsy can be done by taking a sample of tissue for examination under a microscope. Taking a culture. The healthcare provider examines and swabs the tooth. So the sample is treated with a substance which encourages growth. So if germs that cause infection are found, then the culture is positive. Coming to treatment, acute laryngitis often gets better on its own within a week or so. Self care measures such as voice rest, drinking fluids, and humidifying the air also can help improve symptoms. Chronic laryngitis treatments are aimed at treating underlying causes such as heartburn, smoking, or excessive use of alcohol. Medications used in these cases, such as antibiotics. So, in almost all cases of laryngitis, an antibiotic won't do any good because the cause is usually viral. But if you have a bacterial infection, doctor may recommend antibiotic. Corticosteroids. So, this treatment is used only when there is an urgent need to treat laryngitis, so which can help reduce vocal cord inflammation. Antifungals. If laryngitis is related to candida or yeast infection, they may be given antifungal. Voice therapy to learn to listen behaviors that worsen the voice. Pain medications. So if the patient is feeling pain, I can take acetaminophen or ibuprofen. Surgery is needed in some cases. Coming to prevention. So we can reduce the risk of developing the condition of the laryngitis by practicing good personal hygiene, such as washing your hands before and after eating and after using toilet, and avoiding close contact with people who have respiratory infections, such as cold or flu, avoiding irritants such as smoke or dust, avoid smoking and stay away from second-hand smoke. Limit caffeine and alcohol. Beverages that contain caffeine and alcohol dehydrate the body, which can lead to symptoms of laryngitis worsen. So, not regulating clearly your throat. So, to protect your larynx, so it can irritate the larynx. Not shouting or singing loudly or for long periods of time. Raising your head with pillows when you are sleeping. Drink plenty of water. Keep spicy foods out of your diet. Use humidifiers and menthol inhalers. Include a variety of healthy foods in the diet. Eat fruits, vegetables, and whole grains. So, such which are has several vitamins such as vitamin A, E, and C, important for overall health. So, these foods can also keep mucous membrane in throat healthy. Avoid decongestants which can dry your throat. Thank